The number of people who suffer from pain every day is increasing, and how you manage that pain is extremely important. The Headache and Pain Center has diagnosed and relieved pain for thousands of patients without surgery or addictive narcotics for more than 20 years. Joining us now with more is Dr. Jimmy Ponder with the Headache and Pain Center. Thanks for joining us on Great Day today.
Oh, you're welcome. Glad to be here.
So tell us more about how you and your staff treat symptoms of pain.
Well, the first thing is that we want to make a proper diagnosis. And we treat a lot of different types of pain. So when someone comes in, we take their history and we examine them, and then we order diagnostic tests to try and localize what is causing the pain and see if there's a solution. And hopefully there is a solution, and most of the time there is, without open surgery or some type of addictive opioid medication. So that's our goal, is to try to treat it without surgery or narcotic medications.
And what are some of the most common pain symptoms you see?
Well, the most common thing we see at Headache and Pain Center is low back pain, which sometimes is associated with something called sciatica, where you might have pain down into your buttock or your leg, and sometimes that's associated with numbness. Sometimes you may have weakness of the leg or the extremity. The same thing can happen in the neck. You can have neck pain that radiates down your arm, and it can cause numbness in your hand. Sometimes neck pain is associated with headaches, and of course we treat headaches because we're the Headache and Pain Center. So some of the other things we see, shingles, very debilitating in elderly people. A lot of people that are elderly also suffer with compression fractures of the spine, where their vertebrae become collapsed, and it becomes very painful. And one of the other things we see commonly is pain in the rib cage, irritated nerves in the ribs for whatever reason, trauma, shingles can occur in that area also.
All right, and then of course, treatment, good treatment I should say, wouldn't be possible without advanced technology.
Absolutely, and fortunately at Headache and Pain Center, in both of our locations in Gray and New Iberia, we have a lot of diagnostic equipment on site. One thing that we have in both locations is an open MRI, which is an MRI which typically is very claustrophobic because you kind of get into a coffin-like thing. Well, ours is open, meaning that the sides of it are open and not so claustrophobic. We have x-rays to diagnose sources of pain. We have a bone density machine to diagnose osteoporosis. And we also have an ultrasound machine for any type of other diagnoses that are possible that can be causing pain. We draw labs on site and send all of our labs to LabCorp.
Wonderful. And then real quick here, how do you help patients pay for these procedures?
Well, the most important thing as a physician is to participate in the insurance that they have, because most people either have some type of governmental insurance like Medicare. That's for disabled people and people over the age of 65. If you have some type of private plan, then typically we try to participate in that plan so that we can offer those discounts to patients. So when a patient comes in, we can tell them how much their insurance covers and versus how much they would owe. We can offer payment plans also. And fortunately, because we have an ambulatory surgical facility next to our office, we can offer the services there versus a hospital, and sometimes do the procedure for less than half of what it might cost at a hospital facility.
Wonderful. Thank you so much, Doctor, for your time today.
Okay, thank you.
Thank you. All right, well, the Pain Center has 2 offices, one in Gray, the other in New Iberia. To learn more, head to answertopain.com or call 1-888-415-MD-MD.